Ms. Mitchell, CHIP is a capped allotment and not mandatory spending like some of other federal programs. Can you talk about how CHIP has provided more robust federal budget discipline compared to Medicaid and Medicare or Medicare? Does the flexible benefit design help to control costs and increase outcomes and the program reach?
Medicaid and CHIP are very different from a financial standpoint. They are both mandatory funding. CHIP has the capped allotments that states receive every year. Medicaid is open-ended, so for every dollar a state spends on their Medicaid program, they receive a portion of that back according to their FMAP rate. And the FMAP rate for Medicaid is less than the EFMAP rate that states receive for CHIP. In fact, the EFMAP rate is, for the state share, a 30% reduction in what states receive under the FMAP rate. So that's the difference between the financing on those two.
Okay, thank you. Another question. Under the President's health care law, about half the states have expanded Medicaid to cover childless adults. And again, this is for Ms. Mitchell. Yet CHIP is facing a funding cliff. I'm concerned that we could be subsidizing the care of able-bodied adults and may have lost our focus on the poor and underserved children. That's what it was intended to do, in my opinion. When CHIP was initially passed, who was the target population? I want to hear. And under the broad eligibility provisions today, how has that eligibility income level shifted? This is for Ms. Mitchell.
When CHIP was passed in 1997, the target population was targeted low-income children that did not have access to insurance. So that was the point of CHIP. Did you have anything to add?
Sure. As a part of the CHIPRA program, or CHIPRA Reauthorization Act as well, there was an attention that the Congress put on finding and enrolling uninsured children of Medicaid eligibility limits, and to try and bolster those lower income families over the CHIP that covers children at higher income thresholds. So there is that target group. Without CHIP funding, there is a potential, as we've noted on the panel, that some could become uninsured going forward.
Thank you. Thank you. Ms. Yoakum, OMB has labeled CHIP as a high area program and estimates 77% improper payment rate. I know that GAO has looked at program integrity within Medicaid, but have they looked at the CHIP program?
We have not.
Okay. Can you talk about some of GAO's Medicaid integrity recommendations, since some states run the CHIP inside their Medicaid program?
Sure. Many of GAO's recommendations on program integrity and Medicaid relate to making sure that CMS and the states work together and collaborate on in both information systems and oversight. We most recently have recommended that there be a more intensive look at Medicaid managed care. In our most recent study, we really found that CMS and the states and even the Inspector Generals were not spending time looking at whether payments made by managed care organizations and payments made to managed care organizations were done in a fiscally responsible way. So that's an area of significant need right now.
Thank you very much. Dr. Schwartz, has MACPAC looked at the feedback the governors provided about the current design of the CHIP program? And if so, can you talk about how this will factor into their recommendations on MACPAC? What recommendations MACPAC may be making?
Yes, at the staff level, we've seen some, but not all of the letters that I believe have been sent to the committee. I understand the committee is releasing them, and in which case we will brief our commissioners at our meeting next week, and that will provide the strongest voice for the state perspective in MACPAC's deliberations, because our analyses and our recommendations focus on children, families, the federal government, and the states. So we're very grateful to the committee for asking for those letters from the states, because I think we'll find them very useful.
Very good. Thank you. I yield back, Mr. Chairman.